mother or your father who you had to watch die slowly from a terminal illness that has been torturing them for the past several years. Well, this was the situation with my family. My grandfather was diagnosed with pancreatic cancer. As he progressed through the different stages, his pain increased with every passing day as the pancreatic cancer spread. His suffering could have been relieved in the last years if physician-assisted suicide was legal in the United States. Today I would like to tell you about what physician-assisted suicide is, the history behind allowing physician-assisted suicide, including the stories of several individuals who believe physician-assisted suicide should become legal, and finally, the benefits that family members and healthcare will face if physician-assisted suicide becomes legal. Let me begin by explaining to you what physician-assisted suicide is. Physician-assisted suicide was defined by medicinenet.com as the voluntary termination of one's life by administering of lethal substance with the direct or indirect assistance of a physician. It is also the practice of providing a competent patient with the prescription of medication that the patient would use with the primary intention of ending his or her life. In addition to this, one way that suicide could be assisted by a physician is by providing you with the lethal dosage of medication requested by a terminally ill patient. Another way is that a terminal ill patient could be assisted by a physician is by allowing them to withhold or withdraw themselves from artificial life support or other medical treatments. Furthermore, the cost of legalizing physician-assisted suicide began in California and in Oregon in the early 1990s. Of the two states, Oregon was the only one who passed Measure 16, also known as the Death with Dignity Act, which will allow physician-assisted suicide by the prescription of lethal drugs. As a result, Margaret Baden and her colleagues stated that on June 26, 1997, Washington versus Glucksberg and Bacall versus Cole were the first two cases that claimed constitutional protection for physician-assisted suicide, which gave the decision back to the states. An illustration of human aspect of physician-assisted suicide is what happened to Jane Atkins on June 4, 1990. This Oregon woman in her early stage of Alzheimer's committed suicide with the help of Dr. Kevorkian. He created a machine to help Jane relieve the pain she would face with her disease. Dr. Kevorkian would later face charges stemming from his involvement with Jane Atkins' death, but the charges would later be dropped. Before Oregon passed the Death with Dignity Act, Wendy Mariner stated that a person could be convicted of a crime if aiding suicide is subject to up to 5 years in prison and a fine of $10,000. Following Jane Atkins' case, the United States Supreme Court decided to allow patients to have the right to refuse life support with a living will. Many of these patients seek assisted suicide, have the fear of uncomfortable symptoms. 50% have the fear of actual pain. 47% have lost the will to live. 43 have lost their dignity. 34 feel that they're burdens to their family members, and 30 are dependent on others. This was a statement made by the Arizona University. Another study made by the Arizona State University was that between 1973 to 1991, the patients who agreed that to terminate their lives ranged between 62% to 85%. One explanation for this is that many suffer from many painful illnesses such as AIDS or many different cancers. Another explanation is that the technology has drastically changed the way that medicine saw diseases and its effects. Now I would like to tell you some of the benefits that family members and healthcare could receive if physician-assisted suicide would become legal. According to Margaret Baden, physicians and hospital bills can add up quickly, devastating many budgets and life savings. Those who have limited or no health insurance feel this pain even more after the death of many have harder time paying and making funeral arrangements. Also, according to the Healthcare and Financing Administration, Medicare spends about $30.2 billion annually paying beneficiaries. Margaret Baden found that through Dutch experience, Medicare can save about $251 million through physician-assisted suicide. Additional savings would come from legal fees as costly court battles will not happen. In conclusion, as you can easily see, physician-assisted suicide has always been a subject of debate in the medical, moral, and legal world. I've informed you about what physician-assisted suicide is, the history behind the struggles of allowing physician-assisted suicide, also some of the stories of individuals who believe physician-assisted suicide should become legal, and finally, the benefits that healthcare and family members could face if physician-assisted suicide would become legal. Now I would like to leave you with some questions. What if it were you who got diagnosed with a terminal illness and you have gone through every possible medical procedure to get better, but nothing has worked for you, and you grew tired of the excruciating pain you've been feeling for the past days? Wouldn't you want to have the right to choose whether if you wanted to live with this pain or die? Well, I'm going to leave you with a quote from Don Marquis, who believed that helping a patient which is suffering kill themselves is an act of mercy. Thank you, everybody, for being here.